pain of prostate gland disease can make a grown man crawl on the floor. Now, I have seen this personally, so I know what I'm talking about. It can literally put a man on his knees. So we really don't want to get there. So this is definitely a subject of significant importance to all men. So pay attention. And if this information is valuable to you, share with your friends and family, and let's build this community together. Alright guys, as usual, you're welcome to my channel. I'm Dr. Kelvin. I'm your wellness consultant, which means your health is my topmost priority. If you have not subscribed to my channel yet, I don't know what to tell you again. You know what? Let's remedy this. Look for the subscribe button, hit that subscribe button, and activate the notification icon so that every time new content is put up, you are notified. Let's do this right now. Alright, now in this episode, we're going to talk about the prostate gland. Yes, the prostate gland. It's a very, very small gland. It's been described as a walnut-sized gland, but since I've never seen a walnut before, hey, it's very small, about small as that. That's how small it is. And it's located at the base of your bladder. In fact, your urethra actually passes through the prostate gland on its way to the outside world. Now, you understand this relationship a little later when we talk about some of the symptoms of prostate disease. But suffice to say that the pain of prostate gland disease can make a grown man crawl on the floor. Now, I have seen this personally, so I know what I'm talking about. It can literally put a man on his knees. So we really don't want to get there. So this is definitely a subject of significant importance to all men. So pay attention. And if this information is valuable to you, share with your friends and family, and let's build this community together. So the prostate gland. Yes. Now, what role does the prostate gland play? Well, it plays a very, very important role in the male reproductive system. In fact, it produces a fluid that adds to sperm to form semen. And this fluid plays a significant role when it comes to nourishing the sperm as it travels through the vaginal canal. It also dilutes the acid. I mean, if you're not aware, the vaginal environment is very acidic to protect the vagina from invading organisms. So that acid needs to be neutralized. Otherwise, the sperm will be killed. And so the prostatic fluid plays a key role in this regard. So it's very, very important. Now, why do we need to discuss the prostate? The prostate gland is the source of a lot of discomfort in men. The most common of them all being the benign prostatic hyperplasia. Now, if you're a man and if you do live long enough, at some point, your prostate begins to enlarge. Every single male adult will have his prostate gland enlarge at some point. However, not all these enlargements will result in hospitalization or a need for hospitalization. Some people are able to tolerate the enlargement of the prostate without any issues, but most other men will have to go to hospital for some form of intervention. Now, in the beginning, I mentioned that the prostate gland is right at the base of the bladder and the urethra passes through the gland. Now, when the prostate begins to enlarge, it begins to compress on the urethra such that urine flow from your bladder through the urethra becomes a bit challenging, which brings us to the most obvious symptom of prostate disease. And that symptom is difficulty in urination. Some men will have what we call hesitancy, which means that when they go and stand there to pee, they struggle for the pee to initiate. So they'll stand there for a while holding their penis, but the urine is just not coming out. And that's a symptom called hesitancy. It's because as the bladder contracts to let the urine out, the enlarged prostate prevents that urine from flowing out. So it takes a while. It takes significant gentle coaxing to actually allow the urine to pass through. So hesitancy is one of the most important symptoms of prostate enlargement. The second one is intermittency. As the urine starts to flow, it gets cut off occasionally. So instead of the urine flowing significantly in one go, it gets cut off multiple times. So that's intermittency. Then we have a feeling of incomplete emptying. When you think you are done urinating, you go back to your room or to your office, to whatever you are doing, and within a short period of time you have to go back to pee again because the bladder didn't completely empty, and so the little urine that is produced fills the bladder again and you have to go back to urinate. This can be a source of distress, especially in the night. Some men have to wake up 4, 5, 6, 10 times to go to the bathroom, and that can be very distressing. So these are some of the symptoms of prostate enlargement. It can also be symptoms of prostate cancer. In fact, any prostate disease can result in these symptoms. When we talk specifically about prostate cancer, some symptoms now become more apparent. One key symptom of prostate cancer is bone pain. Now you may be wondering, what What has bone got to do with prostate? Well, the prostate gland is very close to the bone of your spine, and so any form of metastasis would immediately go into the spine, into the bones of the spine. And so bone pain, low back pain, is one of the signs of prostate cancer. And so if you have the earlier symptoms associated with bone pain, you really ought to pay attention to it. But let me be quick to add that, as is typical of almost all cancers, they are usually asymptomatic. If you say you're waiting for the symptoms of cancer to do anything about it, you'll probably be dead before those symptoms materialize. So don't wait for the bone pain. Once you notice any of these symptoms I described earlier, you need to go in for a routine checkup. In fact, when it comes to prostate, we know that most people who develop prostate problems are 40 years and above. And so across the globe, once you hit 40, the recommendation is that at least once every year, you need to go in for a regular routine prostate evaluation. Now, the mistake a lot of men make is that they go in for a blood test, which is the PSA, which is all well and good. But understand that not all parts of the prostate produce the PSA. In other words, you could actually have a cancer in the prostate gland which does not impact on your PSA. So your PSA might be normal. It does not mean you don't have prostate cancer. And so apart from doing a PSA test, you also need to have a digital rectal examination, which means, and I know it sounds a bit odd, but yes, a doctor has to stick his or her finger up your backside and examine the prostate fully. It is only after this evaluation that you can confidently say that you have a clean prostate. So you need to get that prostate evaluated as soon as possible if you have never done it before. Now, if we do detect something that might suggest cancer, we need to do further evaluation, such as a scan, a biopsy, just to be sure that what we are dealing with is cancer or is not. Because if it is cancer, the earlier we detect it, the earlier we can intervene, and the earlier you can be cancer-free and return to your life as usual. So don't wait. Get screened immediately. This is very, very important. Now, if you have been following my channel for a while, you know we discuss a lot of men issue, and we know for a fact that men are not good at taking care of themselves. And so if you are here watching on behalf of your husband or your partner, do let them be aware that they need to get screened for their prostate as soon as they clock 40. If you have a family history of prostate issues, then you might need to start screening a bit earlier. So know your family history and start your screening as soon as possible. Don't wait to be told. Prostate cancer will kill you if you don't do anything about it. As usual, if this information has been relevant to you, do subscribe to the channel, do share with your friends and family, and let's build this community together. If you have a question, do leave it in the comment section. I will address them as soon as possible. Thank you. Have a fabulous time. Stay blessed. Dr. Kelvin signing out.